Welcome to the program. As with all cancers, chronic myelogenous leukemia requires careful and regular testing to monitor your response to therapy. The various test results are essential in helping you and your physician determine if treatment response is ideal or if either a change in dosage or even the medication is right for you. As physicians, we rely on our lab to conduct standard blood and cytogenetic tests. The test results tell us a great deal about the level of disease. For example, we use routine blood tests to quantify the number of white blood cells in the circulation. We use cytogenetic tests to look for evidence of the abnormal chromosome, the so-called Philadelphia chromosome, that is a cause of CML. Unfortunately, there are limitations to the standard blood and cytogenetic tests based on the level of sensitivity to detect the presence of your disease. Overall, this is actually a good thing because it often means that you're responding to therapy and these tests are unable to detect the low levels of disease that may remain. So to get a really good picture, we need even more sensitive blood tests. The polymerase chain reaction, commonly referred to as PCR, is what we as physicians rely on to detect and quantify very low levels of your leukemia. We use this test to monitor progress at the molecular level to establish the presence and the quantity of the cancer causing the Philadelphia chromosome. The PCR test is very sensitive, and how it works is actually the subject covered in this video. It's also up to 40,000 times more sensitive than our best cytogenetic tests. What this really means is that PCR can detect one abnormal CML cell among 100,000 normal cells. Thanks to newer medications, many of our CML patients achieve and retain very good responses to treatment. Nevertheless, monitoring a disease remains extremely important, and our physicians will request follow-up PCR tests every 3 months or so. PCR has become indispensable in determining your response to treatment and for longitudinal follow-up. In the following sections, using some fun animation wherever possible, the program will help you understand the basic genetic abnormality of CML and then focus on how the PCR test works, or, as I tell my patients, how PCR can literally find a needle in a haystack. Enjoy the program, and thank you for watching.